The Rundown with Carrie Saldo podcast is funded by Armbrook Village Senior Living in Westfield, offering assisted living and compass memory support with evidence-based treatment for those with memory loss. More at armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. Good morning, I'm Carrie Saldo. It is Friday, February 28th, but it's not the end of the month because this is a leap year. I was thinking, our show, we're kind of like a leap year. Yeah. On my calendar, it says it's a leap year. Karen Brown is judging me and saying, no, it's not a leap year. My calendar is wrong then, Karen Brown.
Sorry.
Okay. All right. We're not like a leap year. Anyway, Karen Brown is in studio with me this morning, as is Jim Kinney and April May Munford.
Hey.
We're here this morning. And if you have thoughts and questions that you'd like to share other than the fact that it's not a leap year, email the rundown at nepm.org. Today, something a bit different. We're here to discuss a special series from NEPM and a special newspaper section from the Springfield Republican, one related to business and the economy and the other centered on healthcare. More specifically, how hard it can be to get access to a primary care doctor in Western Massachusetts. Karen Brown did this two-part series called The Infinite Waiting Room. Almost every workforce survey in medicine right now shows a critical shortage of primary care doctors. In January, Massachusetts Health Policy Commission called the doctor supply a state of extreme challenge, and data shows it's worse in Western Mass than it is for much of the state. NEPM wanted to understand how a shortage in doctors is affecting the health of residents and why this long-time problem is only getting worse. One of the would-be patients that you spoke with, Karen, was Kat Johnson. Let's hear from her.
Half of them were not actually primary care providers. Most of them did not actually have new appointments. The one that did, it was like a 6-month wait.
So, Karen, you found that they're not alone in their struggle. What else did you hear from people about this shortage and how it's affecting patients?
I mean, one thing that was interesting is we were really flooded by people who wanted to tell me sort of how much trouble they had, if not finding a new primary care doctor, then finding an appointment with their existing primary care doctor. There just are not enough doctors in the region and really in the country to care for everyone that needs care. And Kat Johnson, who we were just listening to, they looked through their insurance portals. They went to the ER without a primary care doctor and were given a number to call. And when they called that number, they said, the staff said, we've got a year out. So basically, the details of everybody's story was a little bit different, why they needed a doctor. But what I heard from everyone was that it was just so hard to find an opening.
I'm going through that right now.
April May Munford.
So my primary care has retired, and so I have been on the waiting list since September. And I'm 42.
At the same practice, probably,
At the same
right?
practice,
Yeah.
and I'm 42, so I need certain checkups, and I'm still waiting.
Yeah.
And there, as I read in your reporting, Karen, and heard on our airs, there are at least a few factors that are driving this problem. And Russ Phillips, who heads the Center for Primary Care at Harvard Medical School, was among the folks you spoke with. And he explained that compensation for primary care is one such problem. Here's a little bit more about what he said.
It's not that primary care is paid so badly, but relative to the training that we go through and the other options that medical students face, is there often compelling financial reasons that they might select another specialty.
I mean, that makes sense, right? If you're putting in the time, you want to maximize that in the way that you can.
And I should note that that's not the only reason. It's not just about money. I mean, money is one of those things that's very frustrating because primary care doctors feel like, why is the immense amount of work that we do not valued? And they work really long hours. It's not like their job is easier than a lot of the specialists.
And they're often seeing more patients.
Yeah, they're almost always seeing more patients. But also, this is something that I thought was interesting, is that a lot of medical students just find specialties more compelling. Like when they go through medical school, like to have a really complicated heart condition is, challenging. And what a lot of people told me, including Russ Phillips, is that the primary care education pipeline needs to be better at showing what you get out of being a primary care doctor. You get the relationships, you get the challenge of figuring out all sorts of gatekeeping problems that people have. And that if medical schools and residencies were better at making it, at showing how interesting primary care can be, that would go a long way.
Do we have a relationship with our primary care, though?
Well, this is the vicious cycle, is that if you get more people to go into primary care, then you actually get to develop relationships. So it's very complicated.
The town of Southwick lost a concierge practice. You're reporting,
which we're going to talk about in a minute.
A little bit about that, but it closed. So now the town board is talking about how do we attract a practice into our growing suburban community.
That's interesting that they lost a concierge practice, because most of the time it's the other way around.
Explain, Karen, what a concierge practice is.
Yeah, so concierge practice is where doctors charge a membership fee in addition to insurance. So some doctors will take insurance, others will bypass insurance altogether. That's called direct primary care. But in both of those cases, you have to pay anywhere from $1,000 to, in some places around the country, $50,000. That's not in this area. This is more like maybe to $10,000.
And the idea being that you would get access to appointments more easily, more readily, and have more time spent with you and the physician.
And the reason for that is because they can take fewer patients, right? If they're getting this membership fee, then they don't need 2,000 patients. They can have 300 patients. But what that means is that all those other patients have to find other doctors.
And what happens to the people who can't afford that, right?
Well,
and
exactly.
I think that was beautiful in the article. It's like, people can't afford that. And so it becomes selective.
Yeah.
And then where's the good going?
Right. There's a real push-pull here. Go ahead, Jim Kinney.
I know Bay State has added doctor training programs over the past couple of years, maybe 5 or 6 years. Has that started to have an impact, or is it too small to have an impact?
Well, I actually did a documentary about Bay State's primary care residency program, and I followed this group of doctors over the course of a year. And out of the 5 doctors that I was following, 3 of them changed their minds and went into specialties. So I'm sure it's helping, but these are very small numbers, and even within this small pool of people I was following, they were like, yeah, no, I really want to be a cardiologist. I really want to be a dermatologist.
Because in addition to the challenges that patients are facing, the frustrations that patients are facing, Prel is among them, right, where you can't get access to a doctor. This is frustrating for doctors, too.
Absolutely.
Because what's the impact on the doctors that you heard from?
Well, a lot of people mentioned moral injury, like the idea that you have so many patients, you can only see them for 10, 15 minutes, and you can't do what you were trained to do. Like, they feel really guilty about this. They would love to be able to spend more time. So there's a real push-pull over how do I meet the responsibilities of my job, but also how do I practice the kind of medicine that I was trained to do? And that's why many are choosing concierge. And they're also telling me, the system's brokenness is not our fault. Like, please don't take it out on us.
I think that this is one of the biggest issues on everyone's minds. And I think that this is the biggest challenge of our time, right? Getting primary
out of
care.
many, many challenges.
This is one of the biggest problems.
Yeah.
It was something that I struggled with prior to having our son. I had a nurse practitioner who I loved. I saw her for about a year. She left. I was handed a new person on paper. I never saw that person. I was a patient in name only. They left before I could get an appointment to see them. And now, thankfully, I've had a nurse practitioner Logan just turned 6. So 6 years I've had the same nurse practitioner. And I have felt like I've been able to have a rapport with this person, develop a little bit of a relationship, even though I'm only seeing them 15 or 20 minutes once a year. But that thankfully has developed into a bit of a rhythm. And that's the ideal we want, right? Like you want to develop this relationship and
so
get
that
a
they
sense
can
of
catch things. And
Yeah.
they're like, oh, these blood tests are not what you usually have. You know,
Right.
you
This
need
is
a
not
relationship.
abnormal.
Yeah.
Unfortunately, so many times the doctor is just reading your chart right before they walk in the door. So
Right.
I haven't felt that personal bedside manner because we just haven't had enough time. And there's so many reasons why people lose their good primary care doctors, switch of jobs, switch of insurance, so many reasons why, and then you find yourself going through that insurance portal again, looking around and trying to
and
find...
you feel like there's no one sort of taking care of you. You feel abandoned. I mean, it's hard.
So what are some of the ways, what are some of the solutions here?
I mean, I kind of feel like I've been covering this issue for so long, and the solutions have not changed that much. But there's really hasn't been the political will to put them in. You know, the big one is dedicate more money towards primary care, change the reimbursement. So maybe it's not every time you see a patient you get paid, but maybe you get rewarded for keeping patients healthy. That's a different kind of payment system. A lot of people say if we had a single payer system where you weren't, you know, just being paid for procedures and you were you didn't have that kind of pressure, that would help. But there's not a lot of hope for a single payer system at the moment, but I think that would probably go a long way. And then there's also, and this is happening, and as Jim was mentioning also, training programs are trying to get more med students to go into primary care. And there are things that they can do to make it more interesting, or to get people to maybe sign contracts. You know, if you agree to go into primary care for 5 years, you will get a bonus, or we will give you this kind of advantage. So they're trying things, and hopefully something will work.
Different incentive structures. And then there's also the challenge of the geography of Western Mass versus if you're a young medical student, it might be more exciting and fun to live in Boston as opposed to embrace a rural lifestyle. So there's lifestyle choices there too, complicating this already very complicated issue that we're really grateful you took a deep dive look at. It's The Infinite Waiting Room, and you can check out both parts of Karen's series on the NEPM website. Okay, I'm going to move us on to some special reporting now by the two journalists we have here this morning, Jim Kinney and April May Munford from the Springfield Republican. The stories were a part of the paper's Outlook 2025 special section. This section, Jim let me know, has been happening for more than 40 years at the Republican. And Jim, I know that business is a big part of your beat at the paper, near and dear to your heart. Do you eagerly look forward to Outlook every year?
Eagerly, yeah. It's a lot of work. It's a lot of work. But it gives you a chance to look at a bunch of different issues that aren't the daily grind of, I got to get 12 inches on this by deadline kind of a
As a
reporting.
former beat reporter, I remember getting assigned special sections, and sometimes it just felt like a homework assignment that I didn't want to complete. But I do, as a reader, really enjoy Outlook. I feel like it's useful information. I learned something. Sometimes special sections at a newspaper just felt like a way for the paper to make money on ad revenue. And this feels, as a user, as a reader, it feels really useful. So I do appreciate that about this section. One of the topics you took a look at, work from home. And while some of us are still given the flexibility, more and more we are seeing that employers are calling for this return to the office. And Jim, you wrote about it this way, quote, many workplaces mandated return to in-person work in 2024, and the trend is expected to continue in 2025, much to the relief of landlords and businesses that depend on the lunchtime foot traffic of downtown office workers. Employees at Amazon, AT&T, and other corporations were all called back to the office. President Donald Trump called federal workers back into the office too. Jim, hit us. Go ahead.
To fire them. No.
Right. Yeah.
Brutal. It's certainly a challenge, right? What do we know nationally about who's working from where?
It seems like a lot of offices that I talk to, a lot of the bigger employers here in the Valley, were doing like a hybrid 4 days mandated in the office, 1 day mandated off at home. And you can see that if you go to some place like a Tower Square here in downtown Springfield. Fridays, today, this afternoon, is going to feel
Crickets.
a little slow in there.
Yeah.
But a lot of places are mandating, the 4 days back in, and the trend seems to be that management wants people in. When we ran it in the special section, we ran it next to a column from Dom Sarno, mayor here, encouraging people to come back into the office just because of that economic vitality in the Metro Center.
Mass Mutual, one of the largest employers in the region and number 102 on the Fortune 500 list, as you point out in your reporting, they are embracing this hybrid model. Downtown Springfield businesses, especially Tower Square, I've seen a big difference. During COVID, it felt really vacant. We saw people, restaurateurs, leaving Tower Square, but that's changing a little bit now, isn't it?
Yeah, we've seen a couple new ones open in there. And they seem to be recruited in. The pizzeria is back, which is a big thing. There's a soul food restaurant and a couple of others. And the landlords are recruiting them across the street in the TD Bank building. A Greek restaurant was recruited in by the new owners of the building as an amenity, as an attractant.
April, I saw you do a little happy dance when I mentioned work from home. You're enjoying that, at least part of the week, it sounds like?
I mean, I think I'm in agreement with some of them. Like, sometimes it is a commute. There's distractions in the office, and you can do a lot from your home office, but other times you need to be in the office to communicate with people face to face. So I see both sides of it. And I think that Jim's article really highlights that business is an ecosystem. It's not a single thing. I think the need for expansion, we need that, right? We need that. And so I think that this article highlights that a lot.
Karen Brown, any thoughts?
Well, I think it's the serendipity that people are missing. But that's part of like being in an office. But it's such a trade-off. And when you don't know who's going to be there, and you're only in for one day, and maybe, the person you might have had a conversation. I mean, it is confusing.
You feel a little sad if you go into the office and you're looking forward to chatting up with your colleagues and they're working from home that day. It is a little challenging.
When Mass Live posted this story on the web and they posted it to their Facebook page, it garnered like 500 comments on Facebook. And the one comment was, working from home, it's not really work. All the meetings only last 20 minutes and are focused on one topic.
I'm like, that's a good thing.
Yeah.
Yeah,
like
we've
that.
all worked with that guy, haven't we?
I feel like that increases productivity. Right. I mean, the other laugh that I got at your story is the guy who pointed out, like, he really enjoys his colleague, his dog, the most out of anyone now. So it's like, not only is the dog relied on for man's best friend, but now he's vying for best colleague. It's a lot of pressure for a dog.
Every once in a while, the story lead hits you.
Yeah,
I also think it's a lot cheaper to work from home, and I think that to some degree, for employees, that's what I mean.
Yeah.
So there's the saving on commuting. There's saving on like the $10 lunches. There's saving on dog sitting.
Yeah.
So I feel like that needs to be factored in there.
I mean, it could translate into corporations saving because you don't have the lights running and you don't have the computers running, and there's savings there somewhere.
Potentially, if you have an empty office building that you have to pay the rent for, even though there aren't people in it. So it's a complicated issue. I'm here to say I hope that work from home remains an option for many people for years and years to come. We are going to take a quick break here on the rundown. When we come back, area manufacturers are recruiting new talent from local vocational and technical schools. At the same time, many school districts are struggling with teacher burnout and attracting new educators. We'll dive in and unpack those details here on the rundown on 88.5. Stay with us. Back in a moment. Welcome back to the Rundown here on 88.5 NEPM. I'm Carrie Saldo, joined in studio by journalist Jim Kinney and April May Munford from the Springfield Republican and NEPM's own Karen Brown. If you have thoughts or questions, email the rundown at nepm.org. If I see it, I can make it. That's the headline on a story that you wrote, Jim, about manufacturers broadening their appeal to young workers in Western Mass in the face of a labor shortage. And these area manufacturers are recruiting new talent from local vocational and technical schools. One student told you that, if he can see it, I can make it. And I love that idea. It just feels really liberating to me, right? Are students enthusiastic about this work, Jim?
They are once they are exposed to it. That's the challenge. The manufacturing industry here in Western Massachusetts is big and it's well compensated, but it takes place in small buildings tucked away in industrial parks. It's hard to get kids excited about it because they don't see it unless they have somebody in their family or they take a field trip. And that's one of the things that the schools and the industries are working hard to do is to open up and have field trips. 7th and 8th graders come in and see these processes and get excited about it. Because a kid, even if they're interested in vocational school, well, they've seen carpenters, they've seen mechanics, body shops. That's in everyday life.
I mean, for me, it's deeply personal, even if it's just me, like, lately it's a lot of Legos in my life, completing that Lego kit, but just the idea of like, oh, you put something together, even if I had to dutifully follow the instructions, that accomplishment coming from actually kind of doing something and watching the students, some of the things that they made, the pictures, their story, they're making these sprockets for bicycles, as you're pointing out, or intricate metal pegboards, or even Star Wars all-terrain walkers. It's really fascinating.
It was really fun. To see these kids, young men and young women, they work hard to try and balance that out, really take to it and really get drawn out. And sometimes these are kids that have maybe not excelled in school up until this point, but now they have something that they like and that's hands-on.
And the pay is not bad either. I mean, you're looking at $23 potentially an hour as a high school junior or high school senior as you're doing your co-op with these folks. And then, as you point out, quote, employers trip over themselves to hire graduates. Tell us more about that.
Yeah, they work very hard. And every student who's eligible and is academically in good shape gets a co-op. These manufacturers want to expand these programs. They want to recruit more people into it because if you go into one of these shops, the average worker's in the 40s and 50s, and they're looking at a demographic problem with retirement and also demand for all of these parts is up. These local job shops, you might not know their names, but they work in aerospace, in medical devices, in firearms, in all these industries.
And you looked at figures from the Boston office of the Bureau of Labor Statistics, and specifically for the Springfield area, as of this fall, 27,000 residents in the greater Springfield area are earning their living in manufacturing. That number fell slightly, though, right?
Yeah, it comes up and down, and one of the things that the industry is really looking at is what's going to be the impact of tariffs. A lot of these companies do business with Mexico, and even more do business with Canada.
Yeah, and it's also connected to this other issue that April took a look at in terms of students need teachers to teach them these skills. But what you found, April, is that teachers more and more often are being overcome by burnout. What did you hear from teachers?
So there are teachers leaving and there's teachers not entering the profession. Leaders say that better pay, support, and autonomy would be good to get the workforce back to where it used to be. They need support from families, and the social challenges have become a bigger problem.
I think, did Mayor Garcia and Holyoke say to you that he is the head of the school committee as well?
Yes.
He is seeing teachers more and more often put in these instances where they're also, in addition to teaching a very full-time job, they're almost social workers in a sense, which is a whole other skill set that they're now required to take on as part of their role?
Correct. And so did school committee member from Springfield, LaTonya Monroe-Naylor. She said the same thing. Sometimes the zoning can create a social structure that is hard for the teacher. Like, for instance, Garcia pointed out that there's one school where there's a lot of homelessness because of zoning, as opposed to another school where there's a lot of zoning in single-family residential areas. And so the teachers are struggling a little bit differently at the school where there's a lot of social issues like homelessness, lack of access to food and mental health care, as opposed to those that are in a different
because in a
zoning
public
area.
school setting, when you say zoning, I think what you're referring to is in a public school setting, they're assigned to a certain school based on where they live.
Correct.
And that's something that we see across Western Massachusetts.
Correct.
Something else, a struggle that occurs to me, the connections with primary care that we were talking about too, right? Like, you're just working so hard, you're struggling with this burnout issue.
Yeah, I mean, burnout is huge, and it comes. It again, it goes back to the vicious cycle. The fewer that there are, the fewer doctors, the fewer teachers, the more work is put on those who are remaining there, and then that makes them more likely to burn out. So, it's got to start earlier in the process.
And the way you reported it, April, quote, post-COVID-19 teacher burnout has surged, leading to departures and deterring new educators. Leaders in Springfield, Holyoke, and Amherst call for better pay, support, and autonomy to retain and attract talent. With over 1,000 unfilled positions in education statewide, burnout is a significant challenge. And that was from Max Page, the president of the Mass Teachers Association, told you that. How is the MTA addressing this issue?
So there's several bills that are out. They want to address the high education costs. They want to address low wages. They want to better benefits for teachers. Just really trying to attract more teachers. Looks like retention wasn't too bad as far as Western Mass compared to the state, but there are different things each district is doing to, create that pipeline of teachers to keep them, or keep them interested, and also, like in Jim's story, attract young teachers to the profession.
And we talked about Holyoke and Springfield specifically, these urban school districts, but rural school districts are struggling with this as well, and yet it's a whole different set of challenges that they're facing, right?
I can't believe the nightmare that I mean, just looking at one budget process for one city is a thing, but to have 4 towns come together and to try to agree on a budget, I think the person I spoke to there was saying, like, the first person hired is the first person fired. However, if they can make it through their first year or so, they really want to stay. So it's really about making sure there's enough money in the budget to go around.
And also think about the anxiety attached to that, right? Like, your first year in your job, you're really working to hone your craft, settle in. And if in the back of your mind you're worried that maybe you're not going to have a job at the end of that year, that's probably leading to this
And right
burnout.
now in our country, there's so much of that kind of anxiety, and it's just trickling to all sorts of industries.
Yep.
What did you find out about male teachers, bringing them into the classroom? A buddy of mine is a school board member, and he talks about just the lack of male teachers. When we were reminiscing growing up, we had a number of male teachers in our elementary school. A lot of that had to do with Vietnam. You got a deferment if you went into education, and then they stayed in the profession.
Yeah, my favorite teacher got in that way. Yeah.
I think, Jim, that's one of the stories I want to start exploring more. I think for a long time I've been thinking about that. And not just male teachers, but, male teachers of color as well. I read an interesting article recently that made me think about this topic again because, there's a shortage of male teachers.
I was thinking about how this burnout issue potentially relates to MCAS and the fact that teachers will no longer be required to have that be part of a graduation requirement, and the stress that I think you spoke about this in your reporting. I've heard about it in the past. The stress of this idea of like teaching to this test or making sure the information is in there and students have that. I wonder if we'll see this issue being helped a little bit by the fact that they no longer need that graduation requirement.
I think the high stakes testing is one big thing that I heard across the board, but also another interesting nuance is that receivership for Holyoke, right? Teachers didn't have collective bargaining rights, so they're hoping that with the high stake testings maybe not gone for sure, but without that added pressure, with the collective bargaining rights being restored to Holyoke, that maybe their 40% turnover rate will.
And as that receivership issue, meaning as the Holyoke schools come back to local control instead of state control. Well, we've been talking about the Springfield Republican Special Section, Outlook 2025, and Karen Brown's NEPM reporting, The Infinite Waiting Room. Check out details for both of those on the website. I'm Carrie Saldo. My thanks to Jim Kinney, Karen Brown, and April May Munford. You've been listening to The Rundown on 88.5 NEPM.